So let's look at a slightly different subject of the use of vaginal progesterone for preventing preterm births in a twin pregnancy. So what is this? It's a systematic review and a meta-analysis. Examine the effectiveness of vaginal progesterone in preventing preterm births and adverse perinatal outcomes in twin pregnancies. The study included data from 11 randomized controlled trials involving 3,401 women and 6,802 fetuses or infants. The primary outcome was preterm labor before 34 weeks, and the secondary outcome was looking at adverse outcomes. So, randomized controlled trials comparing vaginal progesterone or placebo to no treatment in asymptomatic pregnancies with twins. Data analysis was conducted. And so what are the key findings? The key findings were there was no prevention in preterm births, and vaginal progesterone did not prevent preterm birth in unselected twin gestation regardless of daily dose or initiation. There was no improvement in perinatal outcomes. And what is recommended from this study is that vaginal progesterone should not be offered to unselected twin gestations to prevent preterm birth. Now let's look at a slightly different subject in this. So findings of twin gestation with a short cervix. That's routinely what is done is the cervix is measured to check whether it is short, and that gives you a risk of preterm labor. And vaginal progesterone appears to reduce the risk of preterm birth occurring in early gestational ages with twin pregnancies with a short cervix. And it may reduce the same risk of neonatal morbidity and mortality in twin gestation. And so promising results were observed for cervical lengths less than 25 millimeter and less than 30 millimeter. So what is the strength of the study? Up-to-date systematic review of randomized controlled trials, large number of women, large number of twins, and reasonably good data. Well, limitations, again, small groups, mainly those of a short cervix, and possibly non-reporting bias, and that could be used as a negative. So let's say, what are the points of this? So if you look at it, 8 studies included. Vaginal progesterone did not significantly reduce the rate of preterm birth, generally in twin pregnancies, where there was a short cervix of less than 30 millimeter, significantly reduced the preterm birth and reduced neonatal death. If you look at cervical length less than 25 millimeter, again reduced preterm birth and also reduced neonatal morbidity. Most of these studies had a low risk of bias. So in conclusion, it seems that vaginal progesterone does not seem to reduce the risk of preterm birth and improves perinatal outcome. But if the cervix is short, then there's no doubt that there seems to be a change in perinatal morbidity and also preterm birth.